my mom. She goes by
Yes.
Chef Colleen most often. But we're just here to chat because my mom is who got me into this field and got me to be where I am. And I thought it'd be so fun to have you here and kind of talk about it and your background and how we both kind of ended up in this world of integrative healing. I'm thinking to when this kind of all started for both of us, right? So when did you start becoming interested in health and wellness and all that?
I started probably early 2000s when I had some digestive problems, and I had so many tests done, and they couldn't find anything wrong. So
Yeah, you went and they're like, it's normal.
Yeah.
Looks good.
I had everything, I think, done.
So you had to take it into your own hands, right?
I did. Yeah.
Because none of the doctors could help you or find an answer.
Well, they helped me. They told me to go on Nuprin the rest of my life.
Oh, right.
And I was against
medication.
medicine. Yes, I've always been against medication.
So their solution was you're having GI symptoms, whatever, heartburn, bloating, whatever it is.
Right.
And so what you should do is take acid blocker for the rest of your life.
Yeah.
But you didn't like that answer.
No.
So what'd you do instead?
I did some research. I'm like, okay, this can't be. It just didn't make sense in my head to be on medication the rest of my life.
Yeah.
So I started to do research.
I'm also thinking like for research, because this was early 2000s, right? So, I mean, like the internet's so different than what it's like obviously right now too. So like, you could just Google that stuff?
No.
What, you found books?
No.
Like, what'd you do?
No, I did research on like, I don't know. My gut was telling me that it was my diet.
Okay. So you had like an intuitive feeling.
Yes. So I started to research, maybe change my diet. And so I'm like, okay, I just need to learn more about that. I was brought up standard American diet.
Yeah. Where'd you grow up? Tell us where you're from.
Michigan.
She's a Michigan girlie.
Yes, always will be, but live in Arizona now.
Yeah. Midwest, very Midwest. Like,
yes.
It's different even than the West Coast, like the culture and the lifestyle. It's very different. So, grew up in the Midwest. You were never really taught to, but you always cooked even before you were interested in like at home. I remember that in my childhood, we always had home cooked meals. That was like something I really remember. But you got even more into it like around this time.
Right.
So where'd you learn everything from? Like, how'd you get into it more?
So I found a school. It was called SWIHA, Southwest Institute of Healing Arts in Tempe, Arizona. And I went and kind of just went to one of their little talks that they have once a month. And I'm like, wow, this is like really interesting. I got to check this out a little further. And just checked into the whole program and went through, I think it was like a 9-month program at the time. And it just changed my whole outlook on food.
I remember that too as a kid. Like it was really clear when, you were like reading labels and we had like non-toxic cleaning products all of a sudden, and our potato chips were organic, not the Lay's anymore. Everything got switched, and I was probably in like 5th or 6th grade around that time. So, so was it nutrition only that they taught you, or did they talk about other things?
No, the plugins went in the garbage. I quit using the microwave. I didn't just change everything immediately. It took me probably 6 months to a year.
Yeah.
I would just use up what I had, and as I replaced it, I would start buying organic and changing up my oils. But as I was learning, I kept changing and just adding healthier whole foods into my diet, reading every single label before I even put it into my body. And that's where it all began.
Which is a good point. And I tell patients this too. It's not about getting rid of everything overnight or changing everything. Even small changes make a difference. It doesn't even have to be everything. It doesn't have to be all or nothing. Like there's a gray area in between.
Absolutely.
And when you're trying to get to that point, you don't have to just get rid of stuff overnight. See, you guys, I learned it from my mom.
Yeah.
I learned it from my mom, not even at school.
Right. Well, that's where it all started anyway.
That's where it started. Yeah, that's where I got interested. But then you worked, so you ended up working in this kind of field.
I did.
So that kind of sparked the passion. And then you got involved in an integrative cancer center. And tell us about what your role was there.
So I worked in an integrative cancer center in Mesa, Arizona for about 7-8 years. And we worked with cancer patients. I was in charge of the raw food diet. So I completely went raw myself, just so I would know what it was like.
And it's like a raw vegan diet. This clinic was doing a lot of the kind of extreme to, like, it's of course not standard of care. It's very like you go raw vegan, you're doing like high dose vitamin C IVs and ozone. Were they using, do you know, were they using chemos and things too? Or was it both?
Yes, they did.
It was just a whole, it was the whole other more integrative approach. So, okay, so you really then got into the raw vegan stuff when you were there working with the cancer patients.
Yes, I changed my whole diet to that, which I didn't force that on you.
Thank God I've never been vegan, I will say.
Right. But your friends did love my kale chips.
It's true. She's a kale chip master.
Yes.
So you would teach classes there too, right? Because you make food. I remember, because I'd visit you there, I remember, and you'd make food for the patients, but you'd also have classes for the patients, right?
Yes.
So then they'd get involved and actually help out.
Yep.
What was like your favorite
probably
thing you
lasagna,
made?
like a raw
The
lasagna.
raw vegan lasagna.
Was so good. Yeah. There were so many good meals though that you didn't even know that they were like raw.
Yeah.
Once you heated them in the dehydrator.
It's so interesting. It's like a very different way of eating and living than pretty much anyone is used to. It's really different.
I actually wrote their cookbook for them, which I think they still use to this day for their patients that come in, because they come in from all over the world.
Yeah, they travel
this treatment.
Yeah.
And someone does their cooking while they stay there for their treatment. So that was what I did.
I was always interested in medicine.
Yeah.
Before you even worked. Do you remember?
Yes,
like, how old was I?
Second grade.
Second grade?
Said you wanted to be a doctor.
I'm pretty sure I remember being like, I'm going to be an orthopedic surgeon.
Yep, because of
because I had a knee injury.
Yes.
Yeah, I was a gymnast and I had a knee injury and I ended up getting a scope in my meniscus, which was like fine or something. I don't know, whatever. And then after that, I'm like, I'm going to be an orthopedic surgeon.
Yep. So you always had that doctor mentality from
I know.
second
I feel
grade
like it
on.
was just something I knew I was going to do. Like I didn't really even choose it. It just was like, oh, that's what you're here to do. And I just went with it. And then because of the upbringing, obviously, like I was young when all this happened. So I was introduced to a whole foods diet and minimizing chemicals in the home and all of these sorts of things from the time that I was probably in like 5th or 6th grade, I would say. So that was just ingrained in me. Like it was part of my life. And then seeing you work in the integrative cancer center, and then I got a lot of exposure to the integrative world. And I remember you even took me to see a naturopathic doctor in high school. Yeah. And it was a great experience. Like I don't think I really ever thought about it as a career, like naturopathic doctor specifically. I knew I wanted to be in medicine or be a doctor of some kind until I was in grad school. But that was really, I mean, I wouldn't have probably gone that way without that exposure and without you kind of changing your lifestyle around. I don't think I would be here or like doing this or seeing the types of patients I see today.
Yay.
Thank you.
Exciting. You're so welcome. I'm so happy.
So thank you, Colleen. So all of you have Colleen to thank for me being here today. Did you have any exposure to integrative medicine like in your childhood, or what kind of drew you to it? We know your health experiences when you were older, but what about your upbringing?
Well, I think it goes back to like the medicine. Like I said that they wanted to put me on Nuprin, and I was like, okay, this isn't right. So I was brought up like no medicine. We always tried.
Yeah, that's true.
If we were sick, we would get a little bit of whiskey and lemon.
It was the little home remedies. That's so true.
Right.
Grandma doesn't want to take medication. Like that is very part of just how I'm sure it was for you growing up.
Brought up. My father had a garden, so we always were gardening and just always eating from that. So it was kind of that, but even though it was like standard American diet still, but it was a healthier standard American than today's standard American.
Well, yeah, because today it's like everyone's on 10 different medications. I mean, like teenagers are on all these medications. It's really pretty insane. But I guess too, back like however many years ago when you were growing up, it wasn't as common probably for people. Like, do you remember people being sick when you were young? Were there like did your friends have all of these issues that we have today? Like, I mean, growing up, my friends, I'm like, oh, I know friends that have autoimmune diseases as kids, allergies, gut problems, mental health problems. There's a lot of anxiety and depression. Like, did you have that in your?
No, we had none of that. It was very rare to even hear the word cancer or diabetes. If you did hear of it, it was an elderly person only, not a young child or teenager. Yeah, it was very, very rare to hear any of that growing up.
And I'm sure, I mean, it's all related to there's so many changes in the environment, like exposures and diet, and it's starting to catch up to everybody. Like you can see it. Young people are not well, and that's not how it used to be.
That's for sure. And that is, I think, why I switched fields to start working with kids.
Yeah, which is what you do now.
Yeah. So I work with kids.
We didn't get into that yet.
Yeah. So I'll let you
now
lead me on that.
You're still Chef Colleen. But your students call you Chef Colleen.
That's
now.
where I got my name.
Because you work at a school.
I do.
And tell us about what you do now.
So I work at a school for kids on the spectrum, mainly high school and junior high. I teach culinary. So we have fun all day long, just learning to make foods from scratch. I have several different classes I teach. Of course, we have fun too, so I make it kid friendly.
There's different like levels and things though too, of course, right? To accommodate different levels of the students.
Yes.
And so like what are the types of classes do they have names? Or is there a specific focus? Like don't you have one that's more like baking?
I do have baking.
Or like a restaurant.
I have restaurants, so they learn if they're going to be in the restaurant industry, like some basic skills in working in a restaurant, cake decorating, because that's my specialty.
Yeah. Well, the restaurant's a big one though, because you guys help a lot of these students be able to integrate and actually have experience so that then they can leave the school and be more prepared to work and get jobs and those sorts of things, right?
Or their own health. I teach them a lot about their health in every single one of my classes, about how important it is to make things from scratch and read labels and ingredients. And they all respect that I know so much and help them with learning about nutrition.
Well, no one teaches them that, right?
No, not at all.
There's not a lot of parents who are as committed to making sure that their kids are getting quality food or ingredients. And so a lot of kids aren't learning that at home. And I mean, just like how we're talking about, there's a lot of new diseases in younger kids. There's a lot more autism than there ever used to be. Like, I don't know that there probably wasn't autism schools at all when you were growing up. It wasn't a thing.
No.
So
very rare.
Kids on the spectrum also there's a health component to it as well. And so I think it's really important to be teaching them these basic foundational diet things are so helpful for a lot of them. So, and I know you have a lot of fun doing it.
I do. Yes, we have a lot of fun cooking and
you've switched from, you were working more with patients who had cancer, which is an older population, and it's kind of like, well, you already have the disease, and now you're more focused on working with younger population and supporting kids and teenagers who probably don't yet have diseases, but you can help them with their health earlier, right?
Exactly. That was what I kind of felt I was drawn toward after working with cancer for my 7 years or so. I got to catch this before we get to that and kind of talk to these kids. I had no idea I'd be working with kids on the spectrum, which I love.
You're the perfect personality for it. You're so patient and kind and understanding. And so I'm sure that, it's a great job. All of these changes that you made in your lifestyle came when I was a little older, like towards the end of elementary school, beginning of middle school for me. So when I was like a baby, which was we're kind of in that more like standard, but if you're raising kids now, is there anything that you would prioritize like from early on? I mean, I know it's very,
I would definitely, just because a lot of stuff we can't control because of environment, I would try to make sure I would grow most of my own food. I would probably consider like buying a whole cow and freezing it and stuff like that. It's
pretty popular now. Like you can get cow shares with families, and you get frozen, like grass-fed, grass-finished beef, and it can be even cheaper than just going to the store and buying it if you're like buying directly from where the source.
Exactly. So I think I would do more gardening, which I am doing more of that. As you remember, we did have a garden growing up.
Yeah.
But I would do even more of that and try to do as much as I could as far as our own food growing.
Yeah, it's true, because it's not just about the food, but it's also like the sourcing of the food, and even all organic food's not created equally. I mean, and
it's like the water too.
The water, the soil, like it's all, it affects the food so much. So you can grow things organically, but if the soil's not what it should be or doesn't contain the nutrients or the minerals that it should, then you're still going to have organic produce that's less nutrient dense than it could be if you were growing food and doing it yourself, or, you know, buying things directly.
Exactly. Because I did go back to Sweeha again. I took a sustainability class. So I started to learn more about, as far as growing food. So that's what my new thing is right now. So I probably would do more of that. Same thing with like diapers, all that kind of stuff. I would make sure that you would have like no Pampers. I would do hand wash diapers, organic.
There's a lot of chemicals in those sorts of products. And I mean, babies are so susceptible, like, and then putting things on the skin, it gets absorbed right away. So I think it's overlooked. And of course, like, one diaper is not going to hurt anybody. It's the habits of like continuous use of those sorts of things every single day from all these different angles, like the air, the food, the water, the toxins. So it's just about lowering the burden. And you can do that if, you know, you're doing these things yourself at home. Then, you know, at least there's these set things that you can do your best on, and then the rest you can't worry about. No one's going to be perfect. Like, of course, we live in a world where you're never going to escape all of these chemicals and things. So you just have to do the best you can with the things that are within your control.
Right. And discipline.
Yeah,
it has a lot to do, I think, with this type of living too. You have to have discipline.
It's very true.
So easy to fall off the wagon.
And go for convenience and quick and whatever. Because I mean, that's what it's made for, because we're all in this busy, like, go all the time. So it's true. You have to make time for it. Things don't just happen. Like, you have to want it to happen and make it change, or else it's not going to.
Yeah. And everybody wants everything now. So even if anybody's planning to change and follow this type of lifestyle, it doesn't happen overnight. You have to have patience. You have to take your time and just slowly. I mean, I know we're in a world of like now. We want this now, and it's not possible to change overnight.
No,
you have to do it slowly.
No, and it doesn't happen for chronic health issues either. Like, I work with patients all day, and their health issues, it's been for years and years, like 20, 30, 40 years. Some people come in and say, I've had fatigue for 40 years.
Yeah.
And then they want it to be gone overnight, and it just doesn't work that way. I wish it did. If I had the magic pill, I'd give it to you, but I don't. So it's like slowly undoing things and then bringing back into balance. That's what it's all about.
Right. And sometimes when you are changing too, if I remember correctly, as you can get sicker to get things out of your body before you start even feeling better.
For sure. All the time. Especially with patients who have chronic infections and things, like a lot of the Lyme patients, when you start treatment, you actually feel worse for a period of time. And it's similar if you change anything about your lifestyle and you're kind of offloading toxins or having die off from infection, whatever it may be, there can always be a period of worsening before you actually start to feel better too. It's really common.
Yeah, we can go on all day about this stuff, Steph. We're on the same page.
Thanks for chatting with me about all of this. Is there anything that you have, like one final thought or something you want to leave us with?
Of course I do. I'm just like so proud of you and so happy with what you're doing. And you are just doing so many great things for so many people. And you've got like the biggest heart, and
You're going to make me cry
always
on camera.
been all about helping people. And I'm glad you found your calling, and I'm so proud of you.
Thank you. That's so nice. It's true. I care so much about all my patients.
You do.
I really do. So,
and it shows.